Being in an emergency room is extremely stressful. Different sounds, different people, words that sound like English, but you don't understand. It's a lot. Add to that you're in the emergency room with someone you love, someone you care about, someone who has protected you in your life, and it's downright frightening. Today, we're talking about 5 different things you can do to be practical and getting things done while you're in the emergency room. These things are going to help not only your parent, but you and the medical team. The first thing you want to do when you get to the emergency room is figure out who you're talking to. You want to figure out who's in charge, get the basic lay of the land. And then from that point, you want to start gathering up basic information that the medical team is going to need to be able to care for your parent. Those things would be things like a list of your parents' routine medical issues, the things that they are taking medication for on a day-to-day basis, if they have any underlying medical conditions that they're currently receiving some type of treatment for, whether it might be that they're going in for infusions or they're getting radiation. Any of those things would certainly be extremely important. You want to be thinking about their past medical history, if they've had any surgeries, particularly in the last 3 to 6 months. And you want to start making a list of which specialist or which physician groups your parent is seeing. You want to be gathering up information of insurance cards, any type of medical documentation like the medical power of attorney or the healthcare proxy forms. Also, if your parent is a DNR or do not resuscitate, that means that they have signed some type of form that says that in the event that their heart were to stop, they do not want to have CPR. If that is a form that your parent has expressed interest in or has had signed in the past, that is also something you want to be bringing up with the medical team and ideally with your parent if they're able to have that conversation. You want to make sure that your parent has all their basic necessities available for them. And when I say that, I don't mean that they have to have a tablet and they have to have a laptop. They don't have to have all kinds of stuff like that. But there are certain things that are going to make things better for them in the hospital environment. So it's best to start thinking about how you can get those things together while you're sitting there in the emergency room. I would recommend that you bring in their glasses, their cell phone, a cell phone charger, their toothbrush, and lastly, I would have them bring a pair of shoes that are supportive that have a back on them. I would not recommend flip-flops or slides or anything like that. You want a pair of shoes that are practical, that will allow them to be able to get up from their bed without falling. And then if they were to start some therapy at the hospital, they'll be able to walk better with those on than just those little slipper socks. The next thing you want to be thinking about is how you can get access to information. This is something that you want to get jumping on right away when you first get to the hospital. When you're going through the triage process, ask them, how do I get information for my parents? If they say, well, we have to have your parent give permission, great, give them permission. If you have the healthcare proxy, that's when you give it to them. You show them that you're designated to make decisions for your parent if they're not able to do it. You want to ask them if they have some type of a privacy policy where they offer up a code. If there's a code that's assigned to your parent, you want to make sure that you are given that code so that if you walk out of the emergency room to go to the restroom or you were to go to get something to eat and you came back, you could still get back on the unit. It's very important that you have that and that you share that code with the other people that are involved with taking care of your parents. You want to determine which providers are seeing your parents. This can sometimes be confusing if you're in a teaching hospital because you've got lots of different levels of medical providers there. You want to find out who is responsible for your parent and you want to try to speak with them as much as possible. You want to try to figure out when they round, when should we expect you to come back in? Will it be after this test? What should we expect? And it's never a bad thing to ask that question. The other thing you want to do right away is to get signed up on your parents' portal. The healthcare system will have some type of a medical portal where you'll be able to go in and track all the tests that have been ordered. You'll be able to see it in almost real time what the test results are, depending on what type of tests are ordered. That will allow you to keep up with what's happening. And again, that goes back to understanding the expectations of what should be happening and comparing that to what really is happening. All of this goes together to make you a better advocate. That's the third thing you can do while you're in the emergency room. You're going to be able to advocate for your parents. You will become your parent's voice. Your parent is not in their best condition, of course. A lot of times with a stroke, people are not able to speak. Sometimes they're able to speak, but they're not able to understand. So there's a lot of different things that can be happening that can affect your parents' ability to communicate. That means that it's up to you to be the person to step in and keep track of what's going on, to ask pertinent questions, to understand expectations, and to ask questions until you do understand what's happening. The best chance your parent has for a good outcome, aside from being at a hospital, is having a good advocate. And that's you. You want to be there as much as you can, ideally in person. But if not, then you want to be able to call in very often to find out what's happening because you need to be hyper vigilant during this time. You need to be asking things like, what tests are you going to order? When do you think they're going to come get them for that test? Do they have to take them someplace for that test? Or is that something that you do right here? When they take them for the test, is that something that I can accompany them with? When do we get the results back? Do you tell me what the results are, or does it come up on this portal? What's the best way for me to know what's going on? And then based on those tests, what does that mean? You're going to ask different questions at different times, but just know that all of those questions are really important and it makes sense to ask them. The physicians are in and out of all these rooms and they forget who's asked what and what they've explained to whom. And it's really important that if you don't understand, which you may not, then you need to ask the question and say, I'm sorry, let me just make sure I understand what you're saying. Are you saying that they're going to go for this test and I cannot go with them, but they're going to go off the unit? They should be back in about 20 minutes or so. And then after that, it might take another 20, 30 minutes till we get the results. Then you have an idea of what the expectation is. You want to also ask the provider when they're in there, are you making mom or dad NPO, which means nothing per oral, meaning that they cannot take anything in their mouth, no pills, no food, and not even any water. It's really important that you establish that right away because in a hospital system, there's lots of moving pieces, like going to a restaurant and one person brings water and one person brings the rolls. Well, not every table is supposed to get rolls. But if the person bringing the rolls doesn't realize that that table's not supposed to get it, you might get the rolls, but the table who's supposed to get it doesn't. The same thing happens with water in the hospital. So ask the question, is mama allowed to have anything to drink? If they say no, then you be watching for that nurse's aide who comes in and drops off a water pitcher. It's going to be up to you to intercept that water so that your parent doesn't aspirate or choke on the water, which is something that's really common when someone is having a stroke. And then you need to also be considering your parents' medical issues, as we talked about. While you're sitting there, be thinking, normally mom gets her Parkinson's medication at about 3:00 in the afternoon. It's already 3:30. She hasn't had her medication because all of this started earlier in the afternoon. Make sure the physician knows that she hasn't had her levodopa. That's going to affect her ability to move. And so that's going to make it look like her stroke is getting worse. And we don't want the doctors to order more tests thinking her stroke is worsening if she's actually only getting worse because she hasn't had her Parkinson's medication. So be thinking of what medications your parent normally gets. Think about the timing of where you are with those medications. Also think about other conditions your parent has. If your parent has sleep apnea and uses a CPAP at night, if you don't have that CPAP with you, it's going to be really important that you let the hospital staff know to get the respiratory therapist in to get a CPAP set up for your parent, because we don't want them to be nodding off, taking a nap, and having their oxygen drop while they're already having a stroke. Be thinking of what types of routine things they use at home, whether it's because they have a condition that mandates it, or maybe they've just started to make some accommodations because your dad knows that every time he sits in his recliner for more than 2 hours, when he goes to get up, he can barely stand because of his back pain. In that case, with your dad laying there on that gurney, I would expect he's going to have some pretty good back pain. But you can think about those things and mention that to the care team, and they can grab some pillows, they can roll up some blankets, and they can put them underneath his knees to take the pressure off his low back. So again, be thinking about what types of things your parent would be dealing with on a day-to-day basis, and let's apply those things to what's happening in the moment to prevent complications. The fourth thing you can do when you're in the emergency room is you can reach out to other people for some help. It's really important that you stop, notify the people in your life or your parents' life, and let them know what's going on. So often we get caught up on what's going on in the emergency room that we don't even think to call other people and let them know. That could be their mom's therapist is due to come by the house this afternoon at 4:30. I bet they'd appreciate a phone call. It could be that your sister has been on a flight and she's due to arrive in a little bit. It could be that your neighbors need to help you out this afternoon because of things in your life. Be thinking about who you need to notify and notify them. And then when you're on the phone with them, depending on what things are looking like and the situation you're in, you may want to start having conversations about people's availability. Who could be able to help out? Who has got some flexibility in their time in the next few days that might be able to come in and relieve you some so that you can manage some of the things you need to manage? It's never too early to start having those conversations so that you can get some support. Depending on what's going on with your parent, you may decide that you would like to join some type of a support group, whether it's a community support group or an online support group. Having other people that you can speak to about what's happening really helps to reduce the burden as you carry it. This is an emergency. It's not something you were planning on. This is completely unexpected, and you are going to need some support as well as your parents. And then as you're speaking with people, also be thinking about not just their availability, but who they know that might be able to come in and help out. It might be your mom's neighbor. It could be your dad's old partner. It could be the people that they go to church with. Are those people able to come in and help out when your parent goes home, assuming they go home quickly? It's really nice to know who's available and who's willing to help out. The fifth thing you can do in the emergency room is you sit down and think about what things are happening in your life as you're sitting in the emergency room. So often we get caught up on what's going on in front of us that we forget that our own lives are still happening in our absence. All those appointments that you've made, all those things that you've put on your calendar that you manage on a day-to-day basis, those things are still happening. Ask yourself, what's going on at the house? Do I have anyone scheduled to come in and do something for me? Do I need to pay anybody? Do I have an animal at home that needs to be cared for? A dog that needs to be let out? Do I need to pick my kids up from school? Do I need to pick my kids up from the daycare facility at a certain time and I only have a little bit of flexibility? Who do I know that could potentially step in and help out? Am I scheduled to coach basketball tonight? I might have to call the team or I may have to call the assistant coach to step in and figure out if they're available. What about other obligations that I have? People get in a situation like this and they completely blank on all of the things happening in their life because they get so hyper focused on what's happening with their parent. So this is just a gentle reminder to take the time to think about what's going on in your life. Another big thing to think about is your work. Do the people at work know where you are? If you got a quick call and you weren't thinking, you might not even realize that you were supposed to be at work today, or you have to go to work tomorrow and you've already flown to get closer to your parents. So you need to be calling your employer, letting them know where you are. You don't have to explain the whole situation. If it's one of those things where you're going to need to be off for an extended period of time, you can always call back and speak with your HR representative at that point. Talk to them about FMLA or even intermittent FMLA. The other thing is 1 in 5 people over the age of 65 is still working. That means 1 out of 5 people watching this video will not only have to think about calling their employer, but you may need to be contacting your parent's employer. You have to have those same conversations with your parent's employer that are not going to be there. You don't have to tell them why. You just have to say, we're having a medical issue or a medical emergency, and I will be in touch with you. I'd recommend that you put an alarm in the phone so that you don't forget that you're supposed to be contacting your parent's employer back. And then also think about what other bills or obligations are happening. You don't want to miss your mortgage payment because you're so tied up in the emergency room and then your parent gets transitioned to the hospital and you're just not thinking about these things. Or maybe you've got some other bills due and you need to move some money around. Be thinking about what is happening in your own life in your absence. And then lastly, the biggest thing you can do for yourself right now is to try to maintain some degree of balance. This is really hard when you're in the middle of a crisis. But if you can think to yourself, what things are the most important to you for you to feel like you have any kind of control or balance? Those are the things that need to be incorporated even as you sit here in the emergency room. Patients in the hospital will develop delirium because of all the excitement, all the drama, all the bells and people waking them up all hours of the night and never knowing if it's daytime or nighttime. The same thing can happen to you when you sit in an emergency room. Sometimes people will sit in an emergency room for a matter of hours that bleed into a day or more. If you're in that situation, you can get very out of balance very, very quickly. Maybe your anxiety has gotten really high because you're so nervous. You can take some deep breaths while you're sitting there. You can focus on your breathing. You could do some guided meditation through an app on your phone. Or when your parent is taking a nap, you could get up and go for a quick walk. You could get up off the unit, get some fresh air, get some perspective. Or it might just mean that you take a minute and go get something to eat. Or you find some way to get away to get some sleep. You can't be a good advocate for your parent if you are out of balance yourself. I'm here to give you some permission to think about you, even though you're in the midst of this big crisis. You are your parents' best hope for a quality outcome because of your ability to advocate for them. But that advocacy can only happen if you're on your game. I hope this has been helpful for you. I know it's a lot of information. Because of that, I am going to give you a free download of the checklist of all the items that I've just gone over. You can download it directly to your phone, and then you can just tick down the list to make sure you're covering all the things, including locating items for your parent, accessing information, all the different ways you can advocate for them, and lining up help, as well as making sure you're considering all the things in your life that are happening in your absence. The link is down below. It's a free link, and I hope you'll take advantage of it. So, again, this is Cheryl Foster. I wish you all the best, and I hope that you will continue to hope in medicine, but not trust in healthcare. Remember, you are your parents' best advocate.